Ever wondered how to read an ECG? It's a vital skill for medical students and professionals alike. ECG, or electrocardiogram, is a powerful tool that tracks the electrical activity of the heart. It plays an essential role in diagnosing various heart conditions by capturing the rhythm and rate of the heart and detecting any abnormalities in its conduction system. It's like the heart's very own Morse code, sending signals about its health and functioning. Now, let's dive into the process of reading an ECG. Before we delve into the specifics, it's important to understand some basics. An electrocardiogram, or ECG, is a tracing of the heart's electrical activity. It's like a graphic roadmap of the heart, showing us how the electricity travels through it. We start with the P wave, which represents the electrical impulse that causes the atria, the heart's upper chambers, to contract. This is followed by the QRS complex, which corresponds to the contraction of the ventricles, the heart's lower chambers. The final wave is the T wave, which represents the ventricles returning to their resting state, or repolarizing. Each wave, each blip in the ECG, tells us a story about the heart's rhythm, its rate, and even if parts of the heart are enlarged or overworked. It's like reading the heart's diary, letting us peek into its electrical secrets. With the basics covered, we're ready to interpret an ECG. Next, we'll look at intraventricular conduction abnormalities, which includes left bundle branch block and right bundle branch block. These are conditions where the electrical impulses that regulate the heart's rhythm are delayed or blocked. In left bundle branch block, the QRS duration is typically more than 120 milliseconds. You'll notice broad-notched or slurred R waves in leads I, AVL, and usually V5 and V6. There are also deep broad S waves in leads V1-2. This condition can mask ECG signs of myocardial infarction or a heart attack. In right bundle branch block, the QRS duration is also more than 120 milliseconds. The QRS in lead V1 is positive. Broad S waves can be seen in leads IV5-6. Understanding these abnormalities is crucial in reading ECGs. They can give us invaluable insight into the patient's heart health. Being able to identify these conditions on an ECG is vital to making an accurate diagnosis. Let's move on to fascicular blocks and bifascicular blocks. In the heart, there are three fascicles responsible for conducting electrical signals. Impairment in any of these can lead to specific fascicular blocks. For instance, when the left anterior fascicle is affected, we call it a left anterior fascicular block. Similarly, when the left posterior fascicle is impaired, it's a left posterior fascicular block. These blocks can alter the axis of the heart's electrical activity, creating distinctive patterns on an ECG trace. Now, when two of these three fascicles are impaired, we refer to it as a bifascicular block. The most common variant is a combination of right bundle branch block and left anterior hemiblock. It's fascinating how these blockages can result in specific ECG changes, allowing us to diagnose them accurately. Understanding these blocks can help decipher complex ECG readings. Reading an ECG is like solving a puzzle. We've journeyed through the fundamentals, explored intraventricular conduction abnormalities, and delved into fascicular and bifascicular blocks. Remember, a thorough grasp of the basics is paramount before tackling complex ECG readings. Look for the telltale signs: QRS duration, R and S wave patterns, and STT changes. Recognize the subtle cues of conditions like heart block, atrial flutter, and ventricular hypertrophy. With practice and understanding, you'll be able to read an ECG effectively and accurately.